I'm Angela. I'm the owner of Accelerate Wellness, a longevity medicine clinic. We have a new clinic here in town in Sioux Falls, South Dakota, but we also serve clients in 16 other states. So longevity medicine really is two things. It is detecting early indications of disease or early risk factors, and then it is intervening early with some targeted treatments. Our goal really isn't to make you live longer. Our goal instead is really to make you live healthier, happier, and as symptom and disease-free over the next few decades of your life. People use the term health span, and that's really what we're aiming for. We want you to have 10 more good years full of doing all the things that you love instead of those 10 years feeling unwell and living in a nursing home. Basically, we have three main aspects. We call them pillars of our company. And those three main pillars are functional medicine, longevity medicine, and regenerative medicine. Functional medicine people have heard of before, although it differs depending on what place you go to. Here, functional medicine means for us is trying to get to the underlying causes of your disease or your symptoms. And it's things that you've heard like hormone replacement therapy, thyroid support, body composition changes, helping with immune disease, things like that. That is functional medicine. On the regenerative side of our business is helping kind of heal the body on the inside out. So that involves anything from platelet-rich plasma or peptide therapy, those types of things. And then there's the longevity medicine. As for longevity medicine, we target the four main causes of morbidity and mortality. And those four causes are cardiovascular disease, dementia, diabetes, and cancer. With cardiovascular disease, we really take a look at an advanced lipid panel. And so we will look for early indications or early risk factors that may lead to cardiovascular disease, and then we intervene early. For dementia, there's genetic testing. And so we check whether the patient is high risk for dementia. And if they are, we come up with a proactive, personalized plan for cognitive health. Because really, the statistic is that even if you are high risk for Alzheimer's disease, which means your ApoE, you would have an ApoE4/4, that's the genetic test. Only 60% of those people typically come down with Alzheimer's at some point. There's 40% that do not get it. And so that's our goal, is we want you to be in the 40%. And that's our aim. That's what we try to do, is help you get into that category. With diabetes, we really work on metabolic disease. So we'll work on controlling your blood sugars early. And then with cancers, we have a lot of genetic testing that can look for early indications of cancers and work on treating it that way. So with regenerative medicine, we really work at healing the body from the inside out. A few different ways that we can do that. Number one is platelet-rich plasma, PRP therapy. There's peptide therapy, many different types of peptides, but one example is using GLPs. We do use GLPs here as a tool, but we use them a little bit differently than a lot of places will use them. We really aim to microdose GLPs and reduce inflammation in the body. And then we don't use GLPs alone. We really look at the entire body on the inside out, and we try to fix the other areas of the body that may be contributing to weight gain. Those areas include the thyroid. You need to look at the thyroid. Cortisol. You need to make sure you check patient's cortisol and then treat it properly. Because if your thyroid's underperforming, or if you have too much stress going on, that's really going to affect weight loss. Another thing that we also take a look at is your gut microbiome. You can't just be handing out GLPs without fixing and repairing someone's gut microbiome, because that also can contribute to keeping the weight on. For dementia, for example, a lot of people come in concerned because they have a high incidence in their family of dementia. Their parents have it. They see their decline over the years, and they're very concerned that that's going to happen to them. So when they come in, we have a great genetic test that helps determine their risk for Alzheimer's disease, whether they have a low, medium, or high risk. So even if they do have a high risk for dementia, the literature is out there that states that only 60% of those people may come down with dementia at some point in their life. There's a whole nother 40% that can avoid it. So that's what we really work on. So in those cases, we'll come up with a pretty proactive plan for prevention with all kinds of things. It includes lifestyle changes, dietary changes. It includes reducing their toxins and reducing their inflammation. It may include different nutraceuticals or different therapies that target mitochondria and really anything that helps improve cognitive health. And so that is our goal, to really keep them in the 40%. That's also where controlling your blood sugar is so important, because cognitive disease and blood sugar are very closely linked. Right now, they're even calling Alzheimer's type 3 diabetes because of that close connection with blood sugars. So we also work really closely with these people on controlling their blood sugars in a number of different ways, and then helping to reduce insulin resistance, and everything that metabolic disease contributes will also be causing inflammation to your brain. With cardiovascular disease, we take very advanced lipid panels, more advanced than you'll find in traditional medicine. So with plaque formation, it's a pretty complicated process, but there are two main components. One is the type of lipoproteins that your cholesterol is carried in. And so we check those because there's a lot of literature out there on which ones are more dangerous for cardiovascular disease. And then we also check one of the other main components for plaque formation, and that is inflammation of your vasculature lining. How inflamed is your vasculature lining? How sticky is that lining? So we'll look for these indicators in your body. And so we'll look to see if you have the bad proteins that may tend to stick to a sticky lining. If you have those things, we really work on reducing those things. There's a lot of literature that suggests, whether it's nutraceuticals or medications, whatever, depending on the situation, whatever people need, we will target those certain proteins and we will aim to lower them. And then with the inflammation, we'll target that inflammation and again, work on reducing that. First and foremost, when we are checking for cardiovascular disease, we already find that people are coming back at high risk. And in those cases, we will refer them to traditional medicine. We refer to Planet Heart so that they can go in and look and get a calcium score and see if they already have plaque forming that needs to be intervened early. So when we uncover actual disease process going on, we are quick to refer back to experts in traditional medicine as well, because we like to go alongside traditional medicine and work closely with each other. So if we find someone who might have some more advanced stages of cardiovascular disease going on, or advanced diabetes going on, or advanced dementia, we will refer to neurology or endocrinology or cardiology as much as needed. Another cause of morbidity and mortality is metabolic disease. We check your blood sugar and your fasting blood sugar. We also check a number called your hemoglobin A1C, which is a more long-term number of what your blood sugar has been doing over the last 6 to 9 months. And there's a lot of things that can affect your blood sugar. Again, it goes back to if your cortisol is too high or too low, that can be affecting your blood sugar. Your thyroid can be affecting your blood sugar. Your hormones can be affecting your blood sugar. So really, we try to help people balance their blood sugar in a number of different ways, because if your blood sugar starts to get too high and your hemoglobin A1C starts to get too high, you're gonna start moving into the pre-diabetic range. We start helping you get those numbers down and helping the numbers work back towards a better number for you. So start to lower your blood sugar, start to lower your hemoglobin A1C before you get into the pre-diabetes range, and especially into the full-blown diabetes range. And so really there's a difference between a normal lab and an optimal lab. And really why we focus so much on blood sugar control and metabolic disease here is because it leads to these other causes of morbidity and mortality. There's such a close connection between blood sugar and cardiovascular disease. There are studies that say that if your fasting blood sugar is greater than 85, you have a significant risk in sudden cardiovascular death. So that's how closely blood sugar is tied with cardiovascular disease. And it's the same thing with diabetes. They're now calling Alzheimer's type 3 diabetes because of the close link between blood sugar and Alzheimer's disease and cognitive decline. So why is metabolic disease or metabolic syndrome important? Well, 1 in 3 people in the US actually have prediabetes or diabetes. So we really intervene a lot earlier. We'll intervene when people are, going over 5 or mid-5s to really help preventing them getting into prediabetes or full-blown diabetes, because diabetes doesn't just start one day when you're 50 or 60. It really starts decades before, and that's when we step in. 1 in 3 Americans have prediabetes or diabetes already. So we really come in and try to help reverse the early stages and try to prevent you getting into the prediabetes or diabetic state. So why does that even matter? Because these increasing blood sugars and this metabolic syndrome is starting to contribute to cardiovascular disease. It's starting to contribute to dementia. It's the beginning stages of cancer. Blood sugar is so closely related in all the causes of morbidity and mortality. So that's why we really aim to reverse these numbers early instead of letting them just continue to climb over the next few decades of your life. People just want to feel heard. They want someone to take the time to listen to them and really understand what they're going through. And then they want to know that they're not crazy, that there's really reasons behind why they're feeling the way that they're feeling or the symptoms that they're having and the biology that's going on behind it. So what we first do is we have an initial consultation with people where we sit down and we just have a really long conversation about their entire health. We'll learn about their health history, we'll learn about their family history, we'll learn about their lifestyle habits. We may talk to them about relationship and social things going on in their life and really get to understand, if they have stress going on, what is triggering their stress. And then they will explain to us their symptoms. They'll go through a long list of symptoms they may be having and concerns that they have. Towards the end of that lengthy discussion, we'll usually sit down for at least an hour with them. And towards the end of that, we'll really get to what goals do they have. I ask patients, can you list 3 goals that you want us to start on and that you would hope to get results for? I usually ask people, why are you here? Tell me in your own words why you're here. Tell me your concerns. From then, we really get into a lengthy discussion about your entire health history. So we'll go over your past medical history, we'll go over your family history, we'll go over your lifestyle, your stress, what triggers you have going on in your life, and then we'll really get into the symptoms that you may be experiencing. Once we go through that long list of symptoms, we then get to, okay, what are your goals? What do you want to accomplish? What do you want to make better? And there's a number of things that people will come into us for goals. Sometimes they want to sleep better, get more sleep. They want to reduce stress and reduce burnout in their life. Sometimes they're hoping to optimize their labs and optimize their body composition and gain some muscle and lose some fat. There's a whole number of reasons why people come to see us. Sometimes it's perimenopause symptoms. So this discussion really helps us identify what kinds of testing we may need to do for the patient. Because despite what's going on the outside, we also really know what is going on the inside, and that really helps us to come up with our plan on how to best help them. So we may offer them advanced blood tests, including advanced lipid panels or advanced metabolic panels, or genetic testing, anything that may be affecting the inside of their body that helps us give us clues on really how to help them. So once we determine the best testing options for you, the patient will go through their testing process, and then they'll come back to us for a lengthy follow-up. And in that follow-up, that's really where we determine a personalized, proactive plan to help that patient reach their goals. And so I try to tell clients that it's not a short overnight process. This is a little bit longer process, and it really also becomes a lifestyle. We work really as a guide to help empower that client to get their results in a number of different ways. Some of those ways might be, diet and lifestyle changes. Other ways might be, there's a lot of literature on nutraceuticals and how those can help in certain areas. Sometimes it might be adding a medication or making changes in their life. But we have so many tools that can really help clients reach their results that are really outside the world of insurance medicine. There's a lot of interventions that we can do that help people right away and get them to start feeling better. But I always tell people that it's also not an overnight process. We're really here, and we have a whole team of people that are working alongside them to help them get results. But it might take a little bit of time. And so really what we want for people is we want to help them live healthier. We want to help them live happier. We want them to live as symptom-free as possible for the next few decades of their life so that they can do all the things that they enjoy, whether it's spending time with their family, whether it's working, whether it's doing their hobbies and activities, or hiking, anything that you want to do, we want you to be able to do it your best. We really want people to live better. The second category of people that come to see us are really people that are concerned about their risk factors for disease. They may have some history in their family, like their mom has Alzheimer's disease, or their dad had an early heart attack, or they have a lot of cancer risk in their family. A lot of people have cancer. So they come to us looking for help in uncovering some early indications of disease processes. So we perform a variety of testing, whether it's blood work or genetic testing, that really helps to uncover if they have early indications of disease or early risk factors. So the third category of people that come to see us are really people that are wanting to lose weight. So we really encourage people to think about it a little bit differently, and not that they don't just want to lose weight. Really what they want to do is change their body composition. So they really want to change their body from the inside out. So what we really help them to do and encourage them to do is increase muscle mass and decrease their body fat percentage, especially the visceral fat that they have on the inside of their body. Visceral fat is really the fat that you can't see. It's the fat that's packed around the organs, and that's the more dangerous fat that you have. We have a body scanner that can take a look on the inside of their body and give a good starting point of where they're at right now. And then really what we work alongside them to get their numbers better, reduce their fat, but also to increase their strength, because strength is really, really important for your overall health and longevity. We do use GLPs, but we use them as a tool alongside everything else that we do. You can't just use a GLP and not understand what's going on with the thyroid, and understand where their cortisol level is at, and understand everything else that's going on in the body. And if you are just injecting GLPs on your own, more than likely you're also losing a lot of muscle mass, which is really going against you. So regardless of the reason why you're coming in, we have so many tools and interventions that can help you. You don't have to feel miserable. You don't have to suffer. That's why we built this clinic. We are here to help you.